Amidst the soaring infections in the United States, a breakthrough has finally begun in the nation today. Efforts to distribute the nation's first COVID-19 vaccines are now underway as the historic U.S. vaccine campaign has begun. Now, the U.S. FDA has granted an emergency use authorization for the Pfizer-BioNTech vaccine last week, which is claimed to be about 95% effective in preventing COVID-19. The U.S. hospitals are preparing for the first shots to be delivered to people who are in most need of these vaccines. Now, the vaccines are being allocated to different states based on each state's adult population. The states are expected to follow the federal guidance to place healthcare workers and also nursing home residents at the front of the line for receiving the vaccine. Now, more than a third of the U.S. deaths have occurred in long-term care facilities, and over the course of the last 2 weeks, the United States has repeatedly exceeded the 2,000 mark in terms of the fatalities that have been reported linked to COVID-19 on a day-to-day basis. The United States leads the world in the number of deaths related to coronavirus, and it is nearing the 300,000 mark. The total COVID infections have also crossed the 16.3 million mark in the country, out of which 1.1 million new cases have been confirmed in just the last 1 week. An initial 2.9 million doses are to be delivered by Wednesday, and the United States plans to distribute about 40 million vaccine doses by the end of this year, followed by 50 to about 80 million doses in January and subsequently in February as well. Healthcare workers and elderly residents of long-term care homes are the first in line to receive the inoculation of a 2-dose regimen given about 3 weeks apart. Yet it will take months before most Americans can in fact get a COVID-19 vaccine. The reports say that more than 100 million people, or about 30% of the U.S. population, could be immunized by the end of March. And that would still leave the country far short of the herd immunity concept, which could halt the viral transmission. Masks and social distancing will still be needed for months to come to control the coronavirus pandemic. An official source has also informed that U.S. President Donald Trump, Vice President Mike Pence and other top U.S. officials will be offered the vaccine. Essential personnel at the White House and certain officials in all 3 branches of the government are to be vaccinated in the next 10 days. It is not very clear whether President-elect Joe Biden, Vice President-elect Kamala Harris and other members of Biden's transition team will be offered the vaccinations at this point of time. In another development, about $908 billion bipartisan COVID-19 relief plan is set to be introduced in the U.S. Congress as early as Monday. In a bid to win approval, the plan will of course be split into 2 packages. One will be for about $748 billion, which contains money for small businesses, the jobless people, and also for the COVID-19 vaccine distribution. The other package will include liability protections for businesses at about $160 billion for state and local governments. So this, of course, is the big day. So if you are a resident in the United States of America, then your search, then your wait for a COVID-19 vaccine effectively comes to an end from today onwards. About 3 million Americans are estimated to be vaccinated by the end of this month. But that does not mean that the coronavirus pandemic will come to an end immediately, that people need not wear masks anymore. Because according to the health advisory that has been given, people are still expected to wear face masks as it has been prescribed for all these last many months. People will still have to adhere to social distancing. But the coronavirus pandemic, this of course could be one of the very first steps that humans have now taken in a bid to try and bring the number of infections under control. Now, the United States hopes to immunize about 100 million people by the end of March, but that still would not be sufficient because at least about 70% of the population needs to be inoculated to see if a herd immunity kind of a status could in fact be achieved in the society at large, and then perhaps the number of infections would slowly come to a halt. But at this point of time, these are still very, very early days. These are still very preliminary projections. 3 million people is what are expected to be inoculated by the end of this month. Perhaps it could be taken up to as many as 20 million people by the end of this month. And to give us more insights in terms of this very important inoculation drive that is beginning today in the United States, we're joined in by Jagrati Dave, who's joining us live from Washington, D.C. Now, Jagrati, this, of course, is a very significant day in the battle against COVID-19. The United States has started rolling out the Pfizer-BioNTech COVID-19 vaccine.
Yes, it is. It is hugely momentous here in the United States, where we are seeing record numbers of hospitalizations across the country. A really worrying death toll over several days in the last week. So this rollout of 100 million doses of Pfizer's coronavirus vaccine, which is administered in 2 shots, so it will be given to 50 million Americans in the first instance with these doses. This is a huge breakthrough. It will be given to the most vulnerable, so that will be frontline healthcare workers and those who live in care homes who are long-term residents there. And of course, the real challenge after that is to roll this vaccine out, to acquire the number of doses that are required to inoculate the vast majority of Americans.
Absolutely, indeed. Now, one of the big things that have been spoken about around the world is the accessibility of this vaccine and how affordable will it be. At this point of time, do we know as to, at what cost this vaccine is being given out in the United States?
Well, what we know is that this is very early stages at the moment, and it is being given to healthcare workers on the front line and those who are living in care homes. So there has been talk of the government giving vaccines free, although I think there are some charges that some private companies, once they're able to get the vaccines, they might be able to provide those for a charge. But at the moment, we are in such early stages. The FDA has just approved the vaccine. The rollout is happening. This mass mobilization, this historic mobilization of these drugs, which is requiring, specialist equipment, because as we know, the Pfizer vaccine requires cold storage facilities. The shipping containers, they're all packed with dry ice. Huge operation involving officials and the post office and FedEx and, shipments going to sites in all the states across the country. So, we're in the early stages of that initial mobilization right now.
Absolutely, indeed. And now that the vaccine rollout has begun, how is the Trump administration looking at it? Because the simple advisory of wearing a face mask in the United States had become a divisive issue. Donald Trump, will he be taking the vaccine?
Well, there are reports that suggest that the vaccine will be offered to the president and the vice president, as well as the staffers that are, and senior officials and staffers that are around the president. And of course, this, the optics of this will be interesting, given that, there are only a limited number of doses that have been acquired in this first stage, with a chance for more to be purchased, to be acquired from Pfizer, with the deal that needs to be made for that. But there is, in terms of face masks, we've talked many times about this administration's reticence to encourage others to wear face masks and how it has become a politicized issue. However, health experts are saying that, the vaccine, whilst it is a light at the end of the tunnel, does not mean that all the mitigation that has been going on so far can just be stopped completely. And there are concerns that, that by health experts, that some people might relax those measures of wearing masks, physical distancing, because they think a vaccine is in the pipeline and that everything is okay. They are saying that no, even with the vaccines, as the vaccines in combination with social distancing, in combination with face mask wearing, that all of that is needed to continue to mitigate, to continue to curb the spread of the virus, which is, reaching really, again, serious peaks, worrying peaks as we are going into the festive season.
Absolutely, indeed. We'll have to leave there. Thank you very much indeed, Jagrati Dave, for joining us and getting us all those insights there.